Hey everyone, welcome to a deep dive into something you might not think about every day.
Mm-hmm.
Surgical adhesions? Have you heard of
Oh,
those?
yeah.
They're kind of these like sneaky bands of scar tissue that
Mhm.
form inside your body after you have surgery.
Yeah, like the uninvited guests at the post-surgery party,
Exactly.
causing all kinds of trouble.
And we're going to really unpack why they matter today.
Yes.
We've got two global expert papers
Okay.
on preventing adhesions during laparoscopic surgery. And
Interesting.
we're talking over 34 international specialists.
Wow.
Combined brain power here. So it's like the all-star team of adhesion research.
That's pretty amazing to see that level of global collaboration,
Yeah,
and it highlights just how big of a deal these adhesions are.
it really does.
Yeah.
And speaking of a big deal,
Okay.
one of our sources from the 2020 SCAR Update study
Okay.
found that a whopping 66 to 79% of people who have abdominal or
Uh,
pelvic surgery
okay.
develop adhesions.
And get this one in 4 of those patients
Oh my gosh.
end up back in the hospital within 5 years
Wow.
because of adhesion-related problems.
So those numbers are pretty alarming.
Yeah.
Imagine going through surgery hoping to solve one problem,
Right.
only to be hit with a whole new set of complications later on.
Exactly. And it's not just about extra trips back to the hospital.
Right.
We're talking chronic pain, infertility, and even bowel obstructions.
Oh, wow.
So it's serious stuff.
Adhesions are clearly a problem.
For sure.
So let's get into what these experts recommend for preventing them.
Well, the first thing might sound kind of obvious,
Okay.
but it's worth repeating.
Mm.
Avoiding surgery altogether whenever possible is the best way to prevent adhesions.
Makes sense.
No surgery means no risk of what doctors call iatrogenic adhesiogenesis.
Iatrogenic adhesiogenesis.
I know it's a mouthful.
That's a mouthful.
Basically, adhesions caused by medical treatment.
Okay, so sometimes the cure
Yeah.
can inadvertently cause another issue.
Right, exactly.
But of course, surgery is often necessary.
So what happens then?
Well, when surgery is unavoidable,
Okay.
these experts stress the importance of minimally invasive techniques
Okay.
and a meticulous approach called microsurgery.
Okay.
It's all about minimizing trauma to your tissues during the procedure.
So it's not just about what they do,
Yeah,
but how they do it.
exactly.
Kind of like the difference between a bulldozer and a skilled sculptor, right?
Precisely, even small surgical choices,
Okay.
like the type of sutures used, how bleeding is controlled, and minimizing the use of heat to seal blood vessels can make a huge difference.
Interesting.
All these factors contribute to creating the optimal microclimate inside your abdomen during surgery.
The microclimate. Tell
Yeah.
me more about that.
That's one of the things that really caught your eye
It did.
in these papers.
It is fascinating. The idea is that the environment inside your abdomen during surgery,
Okay.
things like temperature, the humidity of the gas they use for laparoscopy,
Oh.
even how they rinse the surgical area, can influence how your body heals
Wow.
and whether adhesions form.
So it's like setting the stage for the best possible healing environment, less trauma, better microclimate, all working together to reduce the risk of adhesions.
Yep,
Makes sense.
it does.
But what about those substances that are specifically designed to prevent adhesions?
That's another key area.
Okay.
These experts highlight several agents like hyaluronic acid,
Uh-huh.
a type of gel,
Okay.
and gelified starch powder have shown real promise in preventing adhesions.
Okay.
And there are even bioabsorbable membranes and a cool technique called hydroflotation,
Wow.
where they use fluid to keep tissues separated while they heal.
So that sounds promising.
It is.
But you know what's interesting?
What's that?
The papers say that these agents are currently underutilized.
Mm-hmm.
Why aren't they being used more often?
That is a great question.
If they can help.
Yeah, and unfortunately there's no easy answer. It could be a mix of factors.
Okay.
Some surgeons might not be fully aware of the latest research,
Right.
while budget constraints in certain healthcare systems could also play a role.
I see.
And honestly, we still need more large-scale clinical trials
Okay.
to provide definitive proof of their effectiveness
Got it.
and convince everyone to jump on board.
So it's like having a toolbox full of useful tools,
Yeah.
but not everyone knows how to use them or even that they exist.
Exactly.
But I'm curious, what about the future of adhesion treatment?
Okay.
Are researchers looking beyond these existing agents?
Absolutely. The experts point out that most current methods simply act as barriers,
Okay.
physically separating tissues while they heal.
Got it.
But the real game changer will be targeting the underlying biological processes of adhesion formation at the cellular and molecular level.
Ooh, that's where it gets really interesting.
It does.
What kind of approaches are we talking about here?
One exciting area is the use of drugs like alanyl-glutamine.
Okay.
You see, instead of just acting as a barrier, alanyl-glutamine actually works at a metabolic level, tweaking the body's healing response to minimize the excessive inflammation that leads to adhesions.
So it's not just about blocking the adhesions from forming, it's about getting to the root of the problem,
Exact.
preventing them from forming in the first place.
Yeah.
Pretty cool.
Mm-hmm.
And what about antioxidants?
Okay.
I remember seeing those mentioned in the papers too.
Antioxidants are showing real potential as well, especially in preclinical studies.
Okay.
They seem to protect cells from damage and reduce that excessive buildup of collagen, which is a key component of scar tissue.
So it's like a two-pronged attack,
Mm.
minimizing the initial damage,
Right.
and then controlling how the body repairs itself afterwards.
Exactly.
Fascinating stuff. But is the ultimate goal to eliminate adhesions completely?
Yeah,
Like zero adhesions, as they say in the paper.
exactly. Not just reduction, but total prevention. That's the holy grail of adhesion research.
Wow.
Of course, we're not there yet.
Okay.
But with all these advancements in our understanding of adhesion biology, combined with new drug development and surgical techniques, it feels like we're moving in the right direction.
A world without adhesions, that would be incredible.
It would.
It would mean fewer complications, less pain, and a better quality of life for so many people.
For sure.
But as with any scientific endeavor, there are always challenges, right?
There are.
What are some of the hurdles researchers are facing in this field?
Well, one of the biggest challenges is how we actually diagnose and assess adhesions in the first place.
Okay.
Currently, the gold standard is a procedure called second-look laparoscopy.
Wait, another surgery?
Yeah, basically it involves another surgery just to check for adhesions.
That doesn't sound ideal.
It's invasive, it carries its own risks,
Yeah.
and ethically it's not always feasible.
Oh, wow.
But luckily, there are some exciting alternatives on the horizon.
Tell me more. I'm all ears.
Non-invasive imaging techniques like CineMRI and specialized ultrasound.
Hold on, CineMRI?
Yeah.
That sounds kind of cinematic.
It kind of is. Imagine a mini action movie happening inside your belly, and the doctors are looking for the villains,
Okay.
those pesky adhesions. CineMRI takes a series of MRI images over time, capturing movement.
Oh, wow.
This allows doctors to see how your organs and tissues are moving in relation to each other.
Okay.
If something is stuck in adhesion, it becomes visible because of how it restricts movement.
That's so cool. So instead of just a static snapshot,
Right.
it's a whole movie revealing how everything is moving.
Exactly.
Or not moving inside.
Yeah.
Brilliant.
It is pretty cool.
And what about ultrasound?
Okay.
How does that work for detecting adhesions?
Ultrasound, especially when done transvaginally or transrectally, can also pick up adhesions by looking at how tissues move or don't move together.
Interesting.
It's a more readily available and less expensive option than MRI, making it a valuable tool, especially when combined with CineMRI to get a complete picture.
Wow, these advancements in diagnostic imaging are mind-blowing.
They are.
It feels like we're entering a whole new era
Mm-hmm.
in how we approach adhesions, both in preventing them and in diagnosing them. But before we get too carried away with the future, let's bring it back to the here and now. What are the key takeaways from these expert papers, and what should you, our listener, be thinking about?
Well, first and foremost, awareness is key adhesions are a bigger problem than most people realize. With real consequences, we need to be talking about them more openly in doctors' offices, in research labs, and even in policy discussions.
Couldn't agree more. And it's not just a medical issue, it's an ethical one too, right?
Yeah.
The papers emphasize the importance of informed consent,
Yes.
making sure patients truly understand the risk of adhesions.
Mm-hmm.
Before undergoing surgery, it's about empowering you to be an active participant in your own healthcare decisions.
Absolutely. Patients deserve to know about potential complications,
Right.
even ones that might not show up until years later.
So it's about open communication, shared decision-making, and better outcomes for everyone. This has been a fascinating deep dive so far.
It has.
But before we move on to part 2, I have a feeling you have one of your thought-provoking questions for our listener, don't you?
You know me too well. So here's something to ponder. If we can accurately diagnose adhesions non-invasively, does that automatically mean they need to be surgically removed? Just because we see an adhesion on a CineMRI, does that mean it's causing problems and needs to be fixed?
Ooh, that's a great question. It really makes you think about the balance of risks and benefits, the individual patient's circumstances, and even the potential for overtreatment. Just because we can see something doesn't always mean we need to intervene, right?
Exactly. It's a nuanced issue with no easy answers.
Right.
but it's something we need to be discussing more as these new diagnostic tools become more widely available.
We'll be exploring those questions and more in the next part of our deep dive, so stay tuned.
Yeah, it really is a fascinating ethical question to consider.
Right.
And it highlights how adhesions aren't just a surgical issue,
Okay.
but a complex medical, social, and economic challenge, too.
Totally. The economic burden alone is pretty mind-blowing.
Yeah.
Think about all those hospital readmissions,
Right.
repeat surgeries, lost work time.
Mhm.
Those costs add up quickly.
Absolutely. And that's not even factoring in the intangible costs.
Right.
The pain,
Yeah.
the emotional toll, the impact on relationships,
Yeah.
and overall quality of life.
Wow. Yeah, it's a big deal.
It is.
And that's why it's so important to think long-term.
I agree.
Like, an ounce of prevention is worth a pound of cure, as they say.
Mm-hmm.
But I'm curious, the papers also mention some of the difficulties in conducting research on adhesions.
Right.
What are some of the hurdles scientists are facing?
One of the biggest challenges is finding reliable ways to measure
Okay.
how well different treatments actually work.
Got it.
As we talked about, relying solely on second look. Laparoscopy has its limitations.
Yeah,
It's invasive. And ethically, it's not always the best option.
I get it. Plus, even when you can see adhesions,
Right.
figuring out their real impact isn't always straightforward.
Yeah,
Not all adhesions are created equal, right?
exactly.
Some might be totally harmless, while others cause debilitating pain
Yeah.
or mess with how your organs function.
You're exactly right. It's not just about counting adhesions.
Right.
It's about understanding their clinical significance
Okay.
in each individual case.
Yeah.
You could have two people with the same number of adhesions on a scan,
Uh-huh.
but their experiences could be completely different.
That makes total sense. It's like just seeing a picture
Mm-hmm.
doesn't tell the whole story.
It doesn't.
You need to understand how those adhesions are actually affecting the person's life.
Or precisely.
Yeah.
And that's why developing standardized, clinically relevant ways to assess adhesions is so crucial.
Okay.
We need better tools that go beyond just the physical presence of adhesions.
Yeah.
Tools that measure their impacts on things like pain levels, fertility bowel function, and overall quality of life.
So we need a way to translate what we see on a scan into the reality of what the patient is experiencing day to day. That's where listening to patients becomes super important, right?
It is.
Making sure their voices are heard in both research and clinical practice.
Couldn't agree more. Historically, the focus has been on objective measures. How many adhesions, how thick they are, things like that.
Okay.
But that only tells part of the story. We need to understand how adhesions are affecting patients' daily lives, their emotional well-being, their ability to work their relationships, basically their ability to live a full life.
Right. It's a good reminder that medicine is about more than just fixing a physical problem.
Mm-hmm.
It's about improving a person's overall well-being, and that means really listening to their needs, values, and goals.
And that brings us back to the importance of shared decision-making.
Okay.
It's not just the doctor dictating what should happen. It's about having an open and honest conversation with the patient, explaining the risks and benefits of different options, and truly working together to make a decision that feels right for that individual.
I love that it's a collaborative approach where the patient feels empowered to be an active participant in their own care. But let's be real, not all doctors are created equal, right?
Unfortunately, that's true.
Some might be more tuned into the risks of adhesions or more skilled at using those preventive techniques we talked about earlier.
And it highlights the critical need for ongoing education and training for surgeons.
Yeah.
They need to stay up to date on the latest research, the best practices, the new technologies. Everything that's evolving in this field, continuing medical education, is vital for making sure patients receive the best possible care.
Yeah. Even the most experienced surgeon can benefit from staying curious and open to new ideas and techniques.
For sure.
And that curiosity, that drive to constantly improve, that's what's going to fuel those next big breakthroughs
I agree.
in adhesion prevention and treatment.
Well said. The future of adhesion research truly hinges on collaboration researchers, clinicians, patients, and policymakers, all working together to advance our understanding and develop better solutions. It's a team effort, and sometimes those most exciting breakthroughs come from unexpected places.
Ooh, I like where this is going. What kind of unexpected places are we talking about?
Well, for instance, the papers mention the potential of genetic research to identify individuals who might be more prone to developing adhesions. It's still early days, but if we can unlock those genetic secrets, it could revolutionize how we approach prevention.
Whoa. It's like we could predict and prevent adhesions
Right.
before they even have a chance to form. That's amazing.
It'd be pretty amazing.
And what about those risk scores I saw mentioned?
Yeah.
Are those related to genetics?
Not necessarily. Risk scores take a broader approach. Researchers are working on algorithms that consider various factors like the type of surgery, the patient's medical history, even things like BMI and smoking status, to assess an individual's risk of developing adhesions.
Ah, so it's like a personalized risk assessment tailored to each individual patient.
Exactly, and that kind of information could be super helpful for guiding treatment decisions and personalizing preventive measures.
Hmm.
It's all about being proactive and minimizing risk whenever possible.
That's incredible. It's like having a crystal ball for adhesions, but one based on science and data. It's pretty amazing to see how far we've come in understanding this complex issue. But like any scientific field, there's always more to discover, right? What are some of the big questions researchers are still trying to answer?
Well, one of the biggest areas that needs more attention is research into the effectiveness of existing and emerging treatments.
Mm.
We need more high-quality clinical trials to really nail down what works best and for whom, and these trials need to go beyond the easily measurable stuff. They need to be designed in a way that captures the full spectrum of adhesion-related complications, including those harder to quantify, things like pain, fertility, and overall quality of life.
It's like we need to be measuring what truly matters to the patient, not just what's easy to measure in a lab. And speaking of what matters to the patient, I'm curious, what are your thoughts on those ethical considerations we touched on earlier?
That's an important point,
Mm-hmm.
and one that deserves more attention. As our understanding of adhesions grows and our treatment options expand, we need to be having those tough conversations about the ethical implications.
Like, what are the potential downsides of achieving that zero adhesion state?
Yeah.
Would it change how we approach surgery altogether? Would we become more likely to operate knowing that the risk of long-term complications from adhesions was basically gone?
Those are all great questions, and there are no easy answers.
Hmm.
It makes you think about that delicate balance between medical progress and ethical considerations.
Totally. It's a balancing act for sure. And it's not just a conversation for scientists and doctors, right?
Absolutely not. This is a conversation that needs to involve patients, ethicists, and society as a whole. It's about finding the right path forward, one that prioritizes both scientific advancement and ethical responsibility.
This has been a truly eye-opening deep dive. But before we wrap up, part two, I have a feeling you have another one of those thought-provoking questions up your sleeve, don't you?
I do. Here's something for our listener to ponder. We've talked a lot about the medical and scientific aspects of adhesion prevention, but what about the human element?
Hmm.
How can we as individuals and as a society create a culture that prioritizes open communication, shared decision-making, and patient empowerment when it comes to surgical care?
Hmm.
What would that look like?
Ooh, now that's a question that really gets to the heart of it all.
Hmm.
It's about shifting the paradigm from a paternalistic model of healthcare to a truly collaborative one, where patients are active partners in their own journey, and that's a conversation worth having. We'll be back in part three to wrap up our deep dive into the world of surgical adhesions and explore those lingering questions. Stay tuned.
Welcome back to our deep dive into the world of surgical adhesions. It's been quite a journey, hasn't it?
It really has.
From those eye-opening statistics
Mm-hmm.
to those incredible advances in imaging and treatment,
Right.
we've uncovered a lot in the last two parts.
We have a lot to unpack.
We do, and one of the things that really struck me from these expert papers—
Was this emphasis on international collaboration?
oh, for sure.
Researchers and clinicians all around the world sharing knowledge, pooling resources, working together
Yeah.
to find better solutions for patients everywhere.
It makes sense when you think about it.
Yeah.
Adhesions are a universal problem
Right.
affecting people across all borders.
Yeah.
So it's only natural that the quest for solutions should be global too.
Totally. It's like a reminder that science is at its best when it breaks down barriers and unites people around a shared goal.
I agree.
And in this case, that goal is to reduce the burden of adhesions and improve the lives of countless individuals.
Exactly. It's about minimizing pain, preserving fertility, preventing those scary bowel obstructions.
Right.
Basically enhancing quality of life for anyone who's had surgery.
Right. It's about giving patients the knowledge and tools they need to make informed decisions about their care. It's about ensuring that surgeons have access to the latest techniques and technologies to minimize the risk of adhesions in the first place. And it's about advocating for policies that prioritize adhesion prevention and research.
You've hit the nail on the head. It's a multifaceted challenge that requires a comprehensive approach. And while there's still a lot of work ahead, It's encouraging to see how much progress has already been made.
I agree. From those microsurgical techniques that minimize tissue damage to the development of new drug therapies that target the root causes of adhesion formation, it feels like we're on the cusp of a real breakthrough in this field.
And those incredible advances in diagnostic imaging like CineMRI and specialized ultrasound are revolutionizing how we detect and assess adhesions. We're moving from a world of invasive procedures to a world of non-invasive precision.
It's pretty mind-blowing. It's like we're going from a blurry black and white picture to high-definition color movie when it comes to understanding what's happening inside the body.
That's a great analogy, and it all comes down to a deeper understanding of the underlying biology of adhesion formation. Researchers are unraveling the complex mechanisms involved in this process, and that knowledge is paving the way for more targeted and effective treatments.
It's like we're finally cracking the code.
Yeah.
And this shift in understanding is also driving a shift in how we think about the patient's role in all of this.
Absolutely. As we've discussed, patient empowerment and shared decision-making are crucial. It's no longer about the doctor dictating what should happen. It's about having an open and honest conversation, exploring all the options, and arriving at a decision together that feels right for that individual patient.
I love that about this emerging paradigm.
Yeah.
It's collaborative, it's respectful,
Right.
and it puts the patient's needs and values front and center.
And it's about recognizing that each patient is unique with their own set of circumstances and priorities.
Yeah.
What works for one person might not be the best approach for another. It's about tailoring treatment plans to individual needs and preferences.
It's about seeing the person behind the patient.
Yes.
Right. Recognizing that they have a life, a family, a job, a whole world outside of the hospital walls.
Exactly. And that's why it's so important to consider not just the physical impact of adhesions, but also the emotional, social, and economic consequences. These things can have a ripple effect impacting every aspect of a person's life.
That's a really important point. It's a reminder that medicine isn't just about fixing a physical problem. It's about improving people's lives in a holistic way.
Well said. And that brings us back to one of the big questions we've been grappling with throughout this deep dive. What does the future hold for adhesion prevention and treatment?
Right. What can our listener look forward to? What are the big things on the horizon?
Well, I think we can expect to see continued advancements in all the areas we've discussed, more refined surgical techniques, new and improved drug therapies, even more precise and accessible diagnostic tools.
And hopefully a deeper understanding of the genetic and environmental factors that contribute to adhesion formation.
Absolutely. And who knows, maybe one day, thanks to all this research and innovation, adhesions will become a distant memory, a problem of the past.
That would be incredible, a world where surgery doesn't carry the added burden of potential long-term complications from adhesions. It would be a game changer for millions of people.
It would indeed. But until that day comes, there are things we can all do to raise awareness, advocate for progress, and make informed decisions about our own healthcare.
Couldn't agree more. It's about staying curious, asking questions, and being an active participant in our own health journey.
And it's about supporting the researchers and clinicians who are working tirelessly to find better solutions. Every step forward, no matter how small, brings us closer to that ultimate goal of a world without adhesions.
This deep dive has been a real eye-opener for me, and I hope it's been equally insightful for you, our listener. It's a complex topic, but it's one that deserves our attention. So stay informed, stay curious, and keep those questions coming. Thanks for joining us on this fascinating exploration of the world of surgical adhesions.